Joint pain is one of the most common health complaints globally, acting as a significant barrier to mobility, independence, and overall quality of life, particularly for the aging population. The statistics are stark. Over 350 million people worldwide are formally diagnosed with arthritis. However, this figure only scratches the surface, failing to account for the millions more who experience daily joint pain, stiffness, and discomfort resulting from the natural process of aging, previous injuries, or the cumulative wear and tear of a lifetime. For many, the experience is a frustrating daily reality. Waking up with stiff fingers, aching knees, or a sore back can transform simple tasks into daunting challenges. Favorite activities, from gardening and walking to playing with grandchildren, can become limited or even impossible, leading to a cycle of reduced activity, social isolation, and declining well-being. At its core, most joint pain stems from two primary issues: mechanical wear and inflammation. Osteoarthritis, the most common form, is characterized by the gradual breakdown of cartilage, the protective cushion between bones. As this cartilage thins, bones can begin to rub against each other, causing pain, swelling, and loss of motion. The second major cause is inflammation, the body's natural response to injury or illness. In autoimmune conditions like rheumatoid arthritis, the immune system mistakenly attacks the lining of the joints, causing chronic inflammation. However, even in osteoarthritis, a low-grade, persistent inflammatory response contributes significantly to the pain cycle. This inflammation is driven by complex biochemical pathways involving signaling molecules like cytokines and prostaglandins. Conventional medical treatments, such as nonsteroidal anti-inflammatory drugs, NSAIDs, are often effective at managing symptoms. Yet, they can come with a significant list of potential side effects, especially with long-term use, including gastrointestinal distress, kidney problems, and cardiovascular risks. This has led to a growing interest in safer, more sustainable approaches. The concept of food as medicine has gained substantial scientific validation, revealing that simple, natural ingredients found in our kitchens can contain powerful bioactive compounds that interrupt inflammatory pathways and support joint health, often without the harsh side effects of pharmaceuticals. This article explores 7 such homemade drinks, beginning with 3 foundational remedies. Esimene tamomidete, the gentle anti-inflammatory. Often celebrated for its calming properties and its ability to promote restful sleep, chamomile, Matricaria recutita, is also a potent anti-inflammatory agent. Its therapeutic effects are not merely folkloric. They are rooted in a rich concentration of flavonoids and terpenoids, particularly a compound called apigenin. Scientific studies have demonstrated that apigenin works by inhibiting the enzymes COX-2 and lipoxygenase, which are key drivers in the body's inflammatory cascade. This mechanism is remarkably similar to how many NSAIDs function, but chamomile offers a much gentler profile. For individuals with joint pain, this dual-action benefit is invaluable. Inflammation is a major contributor to pain, and a lack of quality sleep can lower pain tolerance and exacerbate the inflammatory response. By addressing both issues simultaneously, chamomile tea can create a positive feedback loop. A cup in the evening can help soothe the day's aches and promote deeper, more restorative sleep, allowing the body's natural repair processes to function more effectively. How to use. To achieve therapeutic benefits, consistency is key. Aim for 2 to 3 cups daily. Prepare it by steeping 1 tea bag or 1 tablespoon of dried chamomile flowers in hot, not boiling, water for 5 to 10 minutes. Covering the cup while it steeps helps to retain its volatile oils, which are crucial for its medicinal effects. Many users report a noticeable reduction in stiffness and pain within a few days to a week of consistent use. 2. Seedling fenugreek water, the Ayurvedic pain modulator. Fenugreek, Trigonella phenum graecum, is a staple in Indian cuisine and Ayurvedic medicine, where it has been used for centuries to treat a wide array of ailments, including arthritis. Its seeds are a rich source of steroidal saponins, most notably diasgenin, as well as alkaloids and flavonoids that possess powerful anti-inflammatory and analgesic, pain-relieving properties. The traditional method of soaking the seeds overnight allows for these beneficial compounds to be extracted into the water, creating an easily absorbed medicinal drink. A notable clinical study highlighted its efficacy when participants with knee osteoarthritis consumed fenugreek. Over 60% were able to significantly reduce their reliance on conventional painkillers over a 6-week period. The active compounds in fenugreek are believed to work by modulating the body's inflammatory response and potentially protecting chondrocyte, the cells responsible for maintaining cartilage health. How to use: soak 1 teaspoon of fenugreek seeds in a glass of water overnight. In the morning, drink the water on an empty stomach. You can also chew and swallow the softened seeds to maximize the benefits, as they are a good source of fiber and other nutrients. The taste is slightly bitter and map-like, which may take some getting used to, but its potential benefits for joint health are well documented. 3. Candy licorice tea, the cartilage protector. Licorice root, Glycyrrhiza glabra, offers a unique, multi-pronged approach to joint pain relief. Its primary active compound, glycyrrhizin, is responsible for its characteristic sweet taste and its potent medicinal effects. Glycyrrhizin has been shown to have an effect similar to the body's own natural steroids. It works by inhibiting an enzyme that breaks down cortisol, the body's main anti-inflammatory hormone, by allowing cortisol to remain active in the body for longer. Licorice tea helps to suppress inflammation throughout the body, including in the joints. Beyond its anti-inflammatory action, licorice may also play a crucial role in protecting cartilage. Some research suggests that its compounds can help to reduce the activity of matrix metalloproteinases, MMPs, which are enzymes that degrade cartilage and connective tissue. By slowing this degradation, licorice tea can help preserve joint structure and function over the long term. How to use and critical safety warning. Licorice tea is best enjoyed after meals, such as after lunch and in the late afternoon. However, its powerful effects necessitate a crucial note of caution. The same mechanism that makes it effective, its influence on steroid hormones, can also lead to side effects if used improperly. Glycyrrhizin can mimic the hormone aldosterone, leading to sodium retention, potassium loss, and a subsequent increase in blood pressure. Therefore, individuals with high blood pressure, heart conditions, or kidney disease should exercise extreme caution. It is recommended to use licorice tea for no more than 4 consecutive weeks before taking a break of at least 2 weeks. Deglycyrrhizinated licorice, DDL, is available as a supplement and does not carry the same risk for blood pressure, but it also lacks some of the anti-inflammatory benefits. 4. Herb nettle tea, the historic cytokine modulator. Stinging nettle, Urtica dioica, has a long and fascinating history as a folk remedy for painful joints. For centuries, the practice of urtication, intentionally applying fresh nettle leaves to the skin over an aching joint, was used to alleviate pain. While this may seem counterintuitive, the practice induced a localized, acute inflammatory response that would paradoxically reduce the underlying chronic pain. Fortunately, consuming nettle as a dried tea provides similar benefits without the sting. The leaves and stems of the nettle plant are rich in a complex array of compounds, including flavonoids like quercetin, carotenoids, vitamins, and minerals. When dried or cooked, the chemical compounds in the stinging hairs, including histamine and formic acid, are neutralized. Modern research suggests nettle tea works by modulating the body's inflammatory pathways in a more sophisticated manner. It has been shown to lower the levels of key inflammatory cytokines, particularly tumor necrosis factor alpha, TNF-alpha, and interleukin-1b, IL-1b, which are major culprits in the joint destruction seen in rheumatoid arthritis. Furthermore, it may interfere with the transmission of pain signals in nerves. One clinical trial demonstrated that patients who supplemented their NSAID prescription with nettle tea were able to reduce their medication dosage significantly. Another study noted that drinking nettle tea twice daily for a month resulted in up to a 40% improvement in reported joint pain scores. Its mild diuretic effect can also be beneficial, helping to flush out inflammatory byproducts and reduce swelling, edema around the joints. How to use? Nettle tea can be prepared using tea bags or by steeping 1 to 2 teaspoons of dried nettle leaf in hot water for 10 to 15 minutes. Its flavor is earthy and grassy, similar to a mild green tea. Drinking 2 cups daily is a common recommendation for therapeutic effects. 5. Fallen leaf cinnamon tea, the metabolic anti-inflammatory. Cinnamon is more than just a fragrant, warming spice. It is a medicinal powerhouse with potent anti-inflammatory properties. The primary active compound responsible for its benefits is cinnamaldehyde, which gives cinnamon its distinct flavor and aroma. Cinnamaldehyde has been shown to inhibit the NF-kappa B signaling pathway, a master regulator that controls the genes involved in the body's inflammatory response. By downregulating this pathway, cinnamon helps to quell systemic inflammation at a foundational level. Perhaps one of the most significant benefits of cinnamon tea for older adults is its ability to help regulate blood sugar. There is a strong, well-established link between chronic high blood sugar, insulin resistance, and systemic inflammation. High glucose levels lead to the formation of advanced glycation end products, AGEs, which are harmful compounds that promote oxidative stress and inflammation, accelerating damage to tissues, including joint cartilage. By improving insulin sensitivity and helping to manage blood sugar levels, cinnamon tea provides an indirect yet powerful benefit for joint health, particularly for individuals with metabolic syndrome or type 2 diabetes. How to use? Enjoy a cup of cinnamon tea in the morning and evening. You can make it by steeping a cinnamon stick in hot water for 15 to 20 minutes or by using a pre-made tea bag. For an added benefit, combine it with ginger. When choosing your cinnamon, it's worth noting the difference between the two main types: cassia, more common and spicier, and Ceylon, true cinnamon, with a milder, more complex flavor. Ceylon cinnamon is often recommended for regular consumption as it contains significantly lower levels of coumarin, a compound that can be harmful to the liver in very high doses. 6. Ginger tea, the circulatory pain reliever. Ginger, Zingiber officinale, is one of the most well-researched natural anti-inflammatory agents. Its potent effects are attributed to its active compounds, primarily gingerols and showgales. These substances are powerful inhibitors of the synthesis of prostaglandins and leukotrienes, which are inflammatory mediators that cause pain, swelling, and fever. In this regard, ginger's mechanism of action is often compared to that of COX-2 inhibitor drugs, but it is generally much gentler on the stomach lining and liver. Beyond its direct anti-inflammatory effects, ginger offers a crucial secondary benefit. It boosts circulation. Proper blood flow is essential for joint health, as it delivers oxygen and vital nutrients to the cartilage and surrounding tissues while helping to carry away inflammatory waste products. For stiff, aching joints with poor circulation, the warming effect of ginger tea can be particularly soothing, helping to increase mobility and reduce pain from the inside out. This makes it an excellent choice for morning stiffness or as a warming drink after gentle exercise. Its well-known anti-nausea properties are an added bonus, making it a soothing beverage for overall digestive health. How to use? Fresh ginger is most potent. Simmer a few thin slices of fresh ginger root in water for 10 to 15 minutes. You could add a squeeze of lemon or a teaspoon of honey to enhance the flavor. Drinking 1 to 2 cups daily can provide significant relief over time. Part 3. Advanced Strategies, Holistic Integration, and In-Depth Conclusion. Approximate 700 words. An integrated approach to lifelong joint health. Having explored a range of foundational and broad-spectrum herbal remedies, we now turn to an advanced option and, more importantly, synthesize our knowledge into a holistic, actionable framework. Managing joint pain is not about finding a single magic bullet, but about creating a synergistic ecosystem of care. This final section examines a powerful detoxifying herb and then provides an in-depth analysis of the common mechanisms, safety protocols, and the essential lifestyle factors that work in concert with these natural drinks to help you move more freely and live with less pain. 7. Blossom Dandelion Tea, the detoxifying powerhouse. Often dismissed as a common garden weed, the dandelion, Taraxacum officinale, is in fact a nutritional and medicinal powerhouse, especially for addressing stubborn joint pain. Its benefits stem from a dual-action mechanism that combines potent anti-inflammatory properties with crucial detoxifying support for the body. The leaves and root of the dandelion contain bioactive compounds like taraxasterol and sesquiterpene lactones, which have been shown to reduce the expression of inflammatory markers like COX-2 and TNF-alpha. What makes dandelion particularly valuable is its profound effect on the liver and kidneys. The liver is the body's primary organ for detoxification, responsible for filtering metabolic waste, toxins, and the byproducts of inflammation from the bloodstream. A sluggish liver can lead to a buildup of these inflammatory substances, exacerbating conditions like arthritis. Dandelion acts as a natural diuretic and a cholagogue, a substance that promotes bile flow, enhancing the body's ability to efficiently flush out these wastes. By supporting the body's detoxification pathways, dandelion tea helps to create a less inflammatory internal environment, providing relief for joints from a systemic cleansing perspective. This makes it an ideal choice for pain that feels deep-seated and is accompanied by feelings of sluggishness or fluid retention. How to use? Dandelion tea can be made from the roots or the leaves. The roasted root has a richer, coffee-like flavor, while the leaves produce a milder, more green-tasting tea. Both are effective and can be found in tea bags or as loose-leaf preparations. The 7 remedies discussed work through several distinct but overlapping biological pathways: COX-2 and prostaglandin inhibition, ginger, chamomile, and cinnamon act similarly to NSAIDs by blocking the enzymes and pathways that produce inflammatory prostaglandins. Cytokine modulation. Nettle and dandelion directly intervene in inflammatory signaling by reducing levels of key cytokines like TNF-alpha, which are central to autoimmune and inflammatory joint conditions. Steroid-like action. Licorice uniquely helps preserve the body's own natural anti-inflammatory hormone, cortisol, offering a powerful systemic effect. Detoxification and circulatory support. Dandelion and ginger provide an essential secondary action by helping the body clear inflammatory byproducts and deliver nutrients to joint tissues. The power of these natural remedies lies in their complexity. Unlike a pharmaceutical drug that targets a single molecule, a single herb contains hundreds of compounds that work in synergy, often addressing multiple aspects of joint health at once, reducing pain, fighting inflammation, improving circulation, and supporting detoxification. Tips for best results. A mandate for safety and integration. The original advice bears repeating with greater emphasis. These drinks are part of a larger wellness strategy, not a replacement for medical care. Start slow and observe. Choose 1 or 2 drinks that appeal to you and seem appropriate for your symptoms. Use them consistently for at least 2 to 4 weeks to gauge your body's response before adding another. Medical consultation is non-negotiable. This